Just check the weather report. There's a flood warning in action, and in more ways than one. We're about to have an adult conversation around here. If you don't want to hear about surgery and certain body parts, you better GTFO right now, because we're about to talk about it. Flood warning. I'm about to flood the world with urine in a few months. Here's something I've been going through. We'll talk about some past and some future. As a spinal cord injury survivor, I'm a survivor, I know that in the past, the way we all went out was from kidney failure. You die a slow and gruesome kidney death. And I've been paralyzed for 17 years, and my kidneys are starting to get a little bit pissed off. Starting to get a little bit of pissed in, which is the problem. My bladder isn't doing what it's supposed to do. The combination of my bladder and the sphincter that wraps around the urethra up at the top, near the bladder, in tandem, they are not doing what they should be doing. They're both tightening at the same time, which is not supposed to happen. It's supposed to, when the bladder spasms to excrete the urine, the sphincter is supposed to relax to allow the urine to flow through it and out the urethra. But my junk is a piece of junk in that way. And so the urine will back up into my kidneys and I will die. Not right away. My doctors have told me that in 10 years maybe, my kidneys will shut down. But it's not an imminent threat. So I'm all good for right now. But I've also been told I should have a certain surgery. I need some remedy. There's a few options. I've settled on what's called a sphincterotomy. They're going to do a little snip here and snip there. Way up at that bladder sphincter that I mentioned. I've been having a hell of a time trying to get an appointment with a local dude in a private practice. Like the best in the world at this, I've been told. He just won't, his office won't return my calls and they won't give me an appointment. So I returned to the VA and said, look guys, don't be mad at me. I tried to go outside the VA and get this done, but it didn't work out. So now I'm crawling back. The miserable wretch is crawling back, pleading, please help me, VA, please. And they worked quickly for once. I've been, like I said, 17 years in the chair. I've dealt with the VA for lots of things. And private hospitals are always faster. The VA really drags its feet all the time. But not on this day. I called the VA on Monday and said, look, I've been waiting for 2 months. And this private doctor nothing's going anywhere. So we're going to have to explore having this surgery done in the VA after all. That was Monday. And the surgeon just called me already on Friday of the same week. And he's going to get me on the books. He estimates it'll be between 1 and 3 months before I'm off to the Augusta, Georgia VA hospital to have this surgery and live. It'll be like a little vacation, a 2 or 3 day vacation in the VA. Get a little nap, have a little surgery. It's good news. I mean, and even a little side nugget of good news that comes along with it. When I started really noticing issues related to this, which was 4 months ago or something, I started taking Flomax as a remedy, a temporary remedy. I was going to need something like this surgery regardless, but it has at least kept me out of pain in the meantime. I'm going to be able to stop taking Flomax too, which is excellent news. I hate taking medicine. For one thing, like just the physical act of taking it, the swallowing of a pill, 2 pills every night, I could choke and die. I'm not good at swallowing things. But even just the side effects of medication, I don't want it. Who wants it? Why do I even need to say that I don't want it? Because nobody wants it. And so I'm happy to be able to stop taking that. And that's the only medication I take, so be back down to zero just as I always have been. So things are looking up.